Hello, everyone. Welcome to Perspectives in Professional Psychology, the podcast where we explore the people, ideas, and innovations shaping the future of our field. I'm Dr. Lance Garrison, and today I'm joined by Dr. Bianka Hardin, a licensed clinical psychologist, an alum of the Chicago School's clinical psychology program, faculty member, and founder of Centered Therapy Chicago. Dr. Hardin brings a remarkable perspective to our conversation. Her career has spanned doctoral training, academic leadership, community mental health administration, teaching, and now the deeply relational work of psychotherapy and clinical supervision. Her practice focuses on adolescents, adults, and families navigating anxiety, depression, trauma, identity development, and major life transitions. In today's episode, we're going to explore somatic and body-oriented therapy, with a particular focus on how modalities such as somatic experiencing and neuroaffective relational model, or NARM for short, are reshaping the way clinicians understand trauma, attachment, and healing. We'll talk about what it means to work beyond cognition and into the nervous system, how body-based interventions support recovery from relational trauma, and what graduate students and early career psychologists should know about these approaches as they become increasingly central to contemporary clinical practice. Dr. Hardin, welcome to the podcast.
Lance, thank you so much for having me. I'm excited to be here with you today and discuss these important topics.
So, Dr. Hardin, I know I talked a little bit about your background, but could you maybe fill in some of the gaps? Tell us a little bit about yourself.
Sure. I graduated from the Chicago School in 2000. I really enjoyed my experience as a Chicago School student and living in Chicago. And outside of that, something important to know about me is that my father was in the Air Force. I was born in Germany. I moved around every 1 to 3 years of my life and lived in Germany, lived across the United States. And I think that experience of growing up bicultural, transitional, being the daughter of an immigrant really kind of shaped my worldview and who I am as a person and as a therapist, and really my attraction to living in Chicago and going to the Chicago School because of its emphasis on multiculturalism and the diversity of this beautiful city and the ability to work with clients from different identities and life experiences. So that's something that's really near and dear to my heart, is really understanding a variety of perspectives and identities. Yeah. And aside from that, I'm a mother of a college student now, so I'm in a life transition myself as an empty nester, and I really enjoy the work that I do. I love supervising, mentoring, teaching, and lifelong learning. So I'm really looking forward to our conversation today.
Yeah, me as well. You know, as I looked at your background, Dr. Hardin, I noticed that over the course of your career, you've held a number of different kind of administrative leadership roles, and then you made this intentional transition into full-time clinical work. And I was wondering if you could talk to us a little bit about what prompted that transition.
Yeah, I have always been really interested in leadership and development, and my dad was a mentor to me on that. He was in the Air Force for 20 years and then transitioned to the business sector as a leader, and he would always pass me leadership books that he would read on planes. And so I've always been reading those things and had this kind of internal desire to learn and grow. And so in the roles that I had, I always thought like about how people were in their leadership roles, how I could create and collaborate. And so being in a municipal government setting, I was exposed to a lot of things that I never thought I would be exposed to, and learning
Yeah.
opportunities as a psychologist. And then I transitioned to the Chicago School to oversee the up and coming child and adolescent track. And I was the associate department chair. And I have this like idea that I want to create something of my own. And in those jobs, I got to do a lot of creating, and I was mentored by wonderful people. And I felt like I was missing something in those roles. And I remember someone at the Chicago school had told me, don't lose your footing in your clinical work. Like, no matter what role that you're in, always maintain at least having a client or two. And so what I thought I could do was to start my own practice and to develop something of my own and integrate all of the things that I've learned across my career into what I'm creating. And so that kind of inspired me to trust myself to do
Yeah.
that. And it was really a leap of faith. It was a risk that I took, but I felt really confident that I would be able to do it and create kind of what I have now, 12 years later, is very different than what I went out to do, when it started, which was
Yeah.
just have a small office and start my own business. So, um, yeah, it's been a really fun and wild ride with ups and downs and lots of learning along the way.
Yeah, it's interesting thinking about your leadership background. One of the things that I often find, and it was certainly true for me when I opened a private practice, is that there's a gap. And I don't know where you fit it in the training for doctoral psychologists, but the business side, the leadership side is something that we don't get a lot of training in. And I think particularly for early career psychologists, they struggle sometimes as they try to
Yeah.
open a business and start a private practice. So I'm wondering if for you, the time that you spent reading those leadership books from your dad and holding those leadership positions, if that kind of influenced the way you started and continue to run your practice.
Yeah, absolutely. I think there's so much to learn that we can't fit into graduate program training. There's just so many courses you can take in the curriculum. And definitely there's a lot related to business development, financial stewardship, budgeting, supervising, having employees that I did not get in graduate school. And for me, it was very important to learn from others and to be under the supervision and mentorship of someone or of a team. And I learned a lot. I worked in a municipal government setting for about 6 years. I learned about the budgeting process. I learned by viewing things that went well and not well. And that was really rewarding for me being on a team. I got to interface with like the police chief, the fire chief, the HR director, community works. I got to go to the monthly meeting with the board and the mayor. I got to hear about like how the community relates to decisions that the municipal government made, things that went really well, how to connect and do marketing, if you will, like how to get
Yeah.
people in for mental health services who aren't traditionally used to going to mental health. So that idea of networking and marketing is something that wasn't emphasized in graduate school.
Right.
So how do we share what we're doing with others and put it into words that aren't too jargony, that make it accessible? And this was before social media, so things are very different now.
For sure.
um, yeah, and then working at the Chicago school, being in a leadership position there, that was really meaningful to me as well. And like, how are decisions made? How are they communicated? How do you implement a decision and make sure that everyone's on the same page? Right. So I learned so much. So I started my practice in 2014 and I graduated in 2000. So that those 14 years of really learning from others was really meaningful, and having mentors is very important, and getting consultation. So now, as someone who's had my business for 12 years, I'm still in two consultation groups with other group practice owners. I pay for my own consultants, right? I get my own supervision. And so I'm still learning and I'm still making mistakes regularly, right? And so I think it's important to kind of learn from those mistakes and really not be an island in terms of thinking you know what you're doing. I think it's important to have humility and kind of have a beginner's mind, and continue to get feedback from clients, from your staff, from your supervisees, from the community about like how are we doing and what can we do better?
Yeah. Yeah, I was wondering, and I think you started planting some of the seeds of this, but I'm thinking about new grads or early career psychologists. What's maybe one or two pieces of advice you would give them? I know consult, consult, consult has got to be there, right? But
Absolutely. Yeah, I mean, I think don't be in such a rush to
yeah,
do something on your own. Like, I think when I graduated, it was less prevalent for people to go out and start their own practices right away. It was more common to go to an agency. There
yeah,
weren't as many group practices that were hiring brand new grads. You know, you would get your experience in the field. And I think there's something extremely valuable about doing that in and getting support at the same time. So, if you choose to go to an agency, a university setting, a medical setting, a group practice setting, make sure that you have the supports around you, that you're not an island, that you are engaging in lifelong learning, that you're getting mentorship. So, my number one advice would be to find a mentor or a supervisor, someone that you trust, that you can be vulnerable with and learn from and really plug into that relationship. Don't do this alone. The work
yeah,
is too hard. Yeah, it's
yeah,
important to be in community and relationship in the work.
yeah, 100% agree. I want to maybe get into more of the practice that you have itself. And I know part of why you got into it was to stay connected to the clinical work. I'm wondering if was there a particular gap in the psychotherapy space that you were hoping to fill, something that you saw that was maybe missing from the clinical space that you wanted to help provide support for?
Do you mean in terms of starting my own practice?
Yeah.
Yeah. Yeah, definitely. Something that was important to me is being a trauma informed therapist. And in 2014, that specific focus was less common than it is now. Like there's more discussion around trauma informed care. But I became interested in trauma therapy in the late 90s, and not a lot of people were doing that work. There wasn't a course in it at the Chicago school that everyone was required to take. I was fortunate enough to get to know Dr. Margot Jacot, who was an adjunct at the Chicago School, who taught me my trauma course and introduced me to that, which was very supportive to me at the time because the clinical work I was doing was all trauma related. I worked with war survivors of war and torture and children in the DCFS system. So really understanding like how working with trauma survivors is different than working with people who aren't trauma survivors was really important to me in my lifelong pursuit of knowledge. I'm still training in that area. So I wanted to fill that gap of having a practice that is trauma informed, relational, because healing happens in connection and relationships, and wanting to be a practice that does relational work that's also feminist, that takes into account how systems and systemic variables impact people's mental health. Like,
Mhm.
we really need to understand macro system issues and systems of oppression and marginalization and how they impact people's healing journey. So, I really wanted that integrated into my practice. And then the fourth important variable was a concept called trauma stewardship, which I learned in my trauma class, a book written by Laura Vandernoot Lipsky that talks about a model for caring for self while caring for others, and how the impact of working with trauma survivors, it can be really serious on the therapist. So the work we do impacts who we are and our worldview. And how can we integrate that into the mental health space, into the group practice, so that we are tending to that as a community and the important work that we're doing. So those are a few things that were really important to me in the creation of my practice. and something that I've maintained since starting it. And it's been really rewarding. And I really enjoy the community aspect of my practice, being in relationship with the staff and students that work here.
I love to hear that focus on self-care as well, because I think it's an easy thing to let slide in a busy practice, but absolutely critical, particularly critical when you're working with trauma, right?
Mhm.
And to create a culture and an environment for all of the clinicians working with you that supports that self-care, I think is very admirable and certainly critical.
Yeah, I think it's really critical for our sustainability, as therapists, as a field, that we really need to be connected to ourselves, tending to ourselves. That's essential. The work is really hard and
Yeah.
it's not getting any easier. Society is very complex right now, and it has been over, since the beginning of time, but it just feels like there's more pressure and demands on us as a society and more disconnection that we're experiencing, especially post pandemic. That like that intentional self care practice and coming together in community is really essential.
Yeah, you start based on where you started. I'm curious, you know, going in being with a trauma-based focus, and you touched on this, the idea or the reality that there are these larger kind of social context that drive mental health at the individual level. I'm wondering, have you seen a shift over the course of your practice and presenting concerns?
I have. I especially saw a shift in 2016 after the election. More people started coming in with the presenting concern around social political
Yeah.
issues, right? And the other shift that happened that seemed profound to me, because I started doing therapy in the late 90s, was that what I noticed was a lot of the presenting concerns were also things that I was experiencing myself as a
Mhm.
therapist. And so then that continued in 2000 during the pandemic,
Yeah.
right? And then there were other profound events related to, I identify as a woman, and so the Me Too movement,
Mhm.
the Kavanaugh hearings, currently what's happening with the Epstein files. And as a woman who also works with people who have experienced sexual abuse for my entire career, I notice that, the things that are happening, I'm also impacted by. And so that level of pure, not that it really exists, but pure objectivity, like it's
Right.
like, oh, I really need to take care of myself. And I especially noticed that during the pandemic, as a group practice owner, who we needed to shift our whole way of doing work
Mhm.
overnight, essentially. And me being the owner of a practice, really feeling a large sense of responsibility, but also being impacted by what was happening.
Mm.
That was the first time in my career where I needed to intentionally step back some of my clinical work because I needed to tend to myself at that time because things were really challenging. So that's kind of the shift that I am seeing, is that more people are coming in with presenting concerns related to what's happening kind of in the world with like a specific ask.
Yeah. Yeah, unfortunately, there's no shortage of precipitating events in the world right now for
Mhm.
people's mental health.
Exactly. Yeah. Yeah.
In terms of the approach that you take, Dr. Hardin, I know, as I was introducing you, I brought up somatic therapy and NARM. I'm wondering if you could tell us a little bit more about what that therapeutic approach or those approaches entail, and maybe what drew you to those approaches in your clinical practice.
Yeah, I'd love to talk about that. Those are some areas that I'm very passionate about and that have really impacted me personally and professionally. And I started training in somatic experiencing around 20, I think. The years are a little hazy for me, but I've been doing trauma-informed therapy from a Judith Herman perspective, like a relational feminist trauma-informed perspective, and really enjoying that work. And I noticed I do long-term therapy that some of the presenting concerns didn't seem to be alleviating, and I understand it's also long-term work. A friend of mine, Dr. Shar Pierce, that I met on my internship, had told me about, she's training in somatic experiencing. Bianka, you would love it. And she mentioned it to me several times, and I thought, well, let me check into this. And so I wasn't fully sure what I was signing up for, but it turned out I was signing up for a 3-year experience that was
Wow.
really intensive and really spoke to the wisdom of the body in the healing journey. And somatic experiencing is a bottom up approach to processing trauma that really works with the nervous system and supporting healing from a nervous system perspective. And so it looked very different than the psychotherapy that I had learned. And it supported me in slowing down and connecting to myself. And there's also this book from Bessel van der Kolk that is called The Body Keeps the Score.
Yeah.
And there's been more written about body oriented approaches since I started in my SE training. But essentially, there's a way that talk therapy from a top down perspective is focusing on the way we cognitively process, but it's not accessing the wisdom of the body and how trauma impacts our nervous system and our body. And so through SE, I learned how to make more of that connection between the cognition and the body and the nervous system. And so that was really profound for me. It was a really exciting experience that was very connecting and also supported me in my own relationship to my own nervous system and ability to slow down and to connect with myself. And so I saw a really profound healing occur as I learned and practiced this modality. And then I became curious about how do I merge my psychodynamic relational approach with somatic experiencing because they felt very different to me. And so I like understanding frameworks. And so then I met Brad Kammer through my SE training, and he was the North American faculty for what is called the NARM Training Institute. And then I decided to train in NARM, which is a top-down, bottom-up approach to processing trauma that integrates psychodynamic, somatic experiencing, and interpersonal neurobiology. And
Mm.
so I trained in that, and I'm still involved in that community. They have level 1, 2, and 3, and I'm now a NARM master therapist and involved with what's now called the Complex Trauma Training Center that focuses on there's a lot of focus on the intersubjective experience of the therapist. And so really getting into countertransference, curiosity, presence, self inquiry, and connecting to oneself as we're in relationship to our clients and working with that relationally. So both of those approaches utilize the wisdom of the body in the healing process.
Yeah. I think many people can even kind of beyond the field are at least heard about cognitive behavior therapy. And you touched on that a little bit, but I don't think I think the kind of framework, the therapeutic framework that you're talking about with C and NARM are going to be much more foreign to people. So I wonder, can you help us distinguish between what a CBT oriented approach looks like and what the SE or NARM approach looks like? What are kind of some of the fundamental differences?
Yeah, so I don't consider myself a CBT therapist, so I can't speak really I won't be able to give that true justice. So I can speak more from like a traditional talk therapy perspective where, a therapist is saying, "How are you today? tell me about your week. How are you doing?
Mhm.
How was that for you? How are you managing that? What are your coping skills? There's a way we're kind of talking through things. And in that therapy, the therapist is inquiring, is
Mhm.
listening, is responding, and usually the inquiry is, what do you think about that? You know, um, how do you feel about that? What do you want to do about that? Let's discuss some problem solving strategies. Here are some coping
Yeah.
skills, right? And so in that, when I work that way, there's a little bit of a fast pace to that,
Mhm.
right? There's back and forth, and I really appreciate those approaches. So I want to you know say that's
Right. Not
great,
taking
right?
anything away from CBT.
Exactly.
Mhm.
Not taking anything away from more what I would call like frontal lobe processing, like the
Yeah.
cognition of that. What distinguishes the C and NARM approaches is that we would slow things down and it would be a slower process and more like noticing any psychobiological shifts in the client. There's a lot that happens in communication that's nonverbal, that if we're
Absolutely.
just listening to the words, we're really missing a lot of information, which could be, like someone might be flushing,
Yeah.
or there might be like a change in their voice, right? Or, the shifting of where their eyes are, or even how their posture is. Maybe they're like more kind of broader or more slumped or looking down. And so what we do is we invite the client to say, what is it that you're wanting for yourself out of our time today? Inviting them to connect to their therapeutic intention and kind of understanding what gets in the way of that, but also inviting them to slow down and connect to what's happening in their body, what's happening emotionally, and so the process is a lot slower. And there are things that you might notice. Like, for example, as I'm talking to you, I'm noticing there's like tingling in my hands,
Mhm.
right? Like, it's probably because I'm excited to be with you and maybe a little bit nervous to be on a podcast, right? And so if I kept talking, I just wouldn't notice that, like, that's there.
Yeah.
Like, and as I notice it, when you invite someone to notice, often there's like a little bit of a breath that happens in settling. And so there's more of these like activation and settling cycles, and really kind of honoring like a connection to maybe what is in this moment versus the story that often passes over a lot of opportunities to connect to maybe what's happening in the body, or connecting to emotion that maybe wasn't allowed to be connected to if we just tell a story.
Yeah.
Does that
Yeah,
make
I'm
sense?
hearing. Yeah, it really does. And
Yeah.
I had a couple different thoughts as you were describing that. That real kind of traditional, and I'll confess I'm very behaviorally oriented. It just that orientation has always resonated with me. But over the years, I've developed a real kind of sense of fondness for the practice of mindfulness.
Mm-hmm.
And that's what I hear you saying. It's so easy for
Yeah.
us to get disconnected, right? We live in our heads. We live in an internal dialogue a lot of times, and that can lead us to get disconnected from the somatic experience. And
Yes.
there's a lot of information there. And
Exactly.
kind of what I hear you describing, Dr. Hardin, is part of the process is slowing down
Yeah.
and really becoming mindful about yourself as a whole person and all of the sensations and feelings, and it's the whole package.
Exactly. Exactly. I got a chill when you said that. Like, I just feel like that's really where the magic is when we allow ourselves to slow down and connect to ourselves. There's so many experiences that we have, in our maybe families of origin, in our community, in our society, where it's all about speeding up or efforting.
Yeah.
or producing something, like making people happy or, whatever it is. And then we disconnect from our authenticity, we disconnect from our feelings, our needs. And so when we can slow down and invite curiosity, right? Invite noticing, have someone see us in that, the therapist is seeing us in that. And so there's an opportunity for attunement, right? That so many people haven't experienced. There's just something that really meaningful and magical happens in those moments when we can wonder about someone, right? How is that for you? What are you noticing? How are you relating to that? There's just this way that maybe if someone hasn't experienced that attunement early on, no one's asked them those questions before. And so they don't have that connection to themselves. And so it's just a rich opportunity. And one thing I've noticed for myself as a therapist is it's been very liberating to let myself know that I don't need to have all of the answers. I'm a human in this, just like my client. I can slow down too. I don't need to pressure myself to perform with this person. I can just be with. And that being with is really what is therapeutic because across all modalities, what is found is that it's a therapeutic relationship that is really
Absolutely.
healing. It doesn't matter what modality you're practicing, but sometimes we tell ourselves, we're the expert, we need to know all the answers. But if we can really work on ourselves and our own material, our own experiences, then we can really support the client. And something I tell people is we can't take a client somewhere where we're not willing to go ourselves,
Mm.
right? And so what's our own relationship with mindfulness, with being slow, with not knowing, with hopelessness, all of that. Like if we can be with that, we can support our clients in being with that too. And I think that's really essential.
Yeah, I'm going to borrow a phrase from Yalom. To me, it's one of the most profound gifts of therapy, right? There are many gifts of therapy, but
Yeah.
it's so rare, sadly, that today there are very few opportunities for people to be fully present with someone else or to have
Yeah.
someone be fully present with them. And that's where the healing begins and happens in the therapy process. We can talk about the cognitions, we can help people build a toolkit of skills, but really all of that's made possible. That the change process in therapy, I think, is largely driven by the relationship and the beauty of having someone fully present with you, authentically present with you.
Yeah, 100%. I feel chills again and like just the sacredness of that
Yeah.
experience. And I love it that you called it the gift of therapy, which I know is from Yalom. And it truly is a gift. And to really be with someone who's not trying to get you to be someone different, not judging you, meeting you where you're at in your own humanity and messiness, because so often we're told we need to straighten our posture, we need to like clean up, we need to do this in order to be loved, right? There's this
Mm,
these
yeah.
conditional experiences in life, right? And we're in so many systems that are evaluative, giving us grades, literally, or performance evaluations. And we've got social media and media telling us like what we should look like and what we should do. And there's this, hustling for our worth, if you will. But
Mm,
just to be able to like let that down and be with someone and not as a therapist effort to change someone and just really have that unconditional positive regard with a client and accepting them where they're at and really wanting them to understand what they're wanting for themselves, but that they don't need to perform for you, the
right.
therapist, and that there is that impulse there often, to be the
Absolutely.
good client. But if we could just be with each other, like that is a gift.
Yeah. Yeah. And the therapist goes in sometimes, particularly early career, with kind of performative expectations of themselves. And it takes
Exactly.
time to get over that, to develop that comfort. You used a word, Dr. Hardin, that struck me because I just used it a few weeks ago. I was I was speaking with a large group of doctoral students in California, and I described therapy as being invited into a sacred space. And
Yeah.
so I love that you use that because it does feel like such a profound opportunity, um, a profound responsibility to be invited into that very
Yeah.
vulnerable space with people. So I love that you use that word.
Yeah, it's an honor really
It
to
is.
do the work that we do, for people to trust us, to be with us, to come back every week, to commit to a long-term relationship. Like, it really is sacred. And I think connecting to that, how sacred and honorable it is for me an act of my own trauma stewardship about, like, why am I doing what I'm doing, and the meaningfulness of the work that we're doing really, like, is profound. We are shifting intergenerational patterns with folks. Like, the work that we do not only impacts the person we're across from, but like people they're connected to.
Yeah.
It's really sacred and meaningful. So that's cool that you're talking about that with your students as well.
Yeah, it's just always felt that way to me. It's just something really, really beautiful and special and privileged to be able to do.
Yeah, absolutely.
So I want to maybe come back a little bit and talk about trauma in particular. From an SE perspective, could you talk a little bit about what's going on in the body when someone is experiencing or recounting trauma?
Yeah, from like an SE perspective, trauma is stored in the nervous system because there's something that needed to happen that didn't get to happen, right? And that someone experienced something that happened too fast, too soon, or was too much, right? Those are some ways of thinking about it, right?
Process properly.
Or not enough time, or maybe they were too young and what they experienced, they didn't have the capacity to process it, or like it happened so quickly and there wasn't enough time to respond with a defensive or protective response, in terms of they weren't able to flee,
Yeah.
they weren't able to fight, they weren't able to defend themselves, and so then when that occurs, we have incomplete responses in the nervous system, right? And so from an SE perspective, what we invite someone to do is become reconnected to their nervous system, right? And invite those responses to occur,
Yeah.
right? Like, what did you need that you didn't get? What does the body want to do? And from a NARM perspective, there's a way that there are incomplete emotions or needs, that the person didn't get to experience. And so, for example, if a child were in a situation where their needs weren't met and something harmful was happening, when you're little, you're not allowed to say, go jump in the lake, parent. Do you know what I mean? Or like, I don't like this, right? Like, you learn really quickly that you need to be pleasing and shut down whatever that healthy protest is or those feelings and adapt to whatever situation that you're in. You might shut yourself down, your authenticity. Like maybe you're a person who really wanted to dance and be a creative, but like your parents are like, no, you need to do sports, and there's a way we shut down parts of ourselves and who we are and our emotions, and so those approaches invite us to reconnect with those parts of ourselves or those needs or emotions that we weren't allowed to or able to when we were younger.
So in some sense, and correct me if I'm misstating this, it's creating a context, a safe space for an individual to, in some ways, go back to that moment and the experience they had, reconnect with the fullness of it, the thoughts, the feelings, that the somatic experience of it, and create space for a kind of a reprocessing of it within that safe context and a reconnection to it from a different perspective.
Yeah, exactly. Like, you might so with SE, it's about the biology, not the biography. So what is
Mhm.
it that the body needs, right? And so
Yeah.
sometimes there might not actually be a vivid story or memory, right?
Okay.
That can
Yeah.
happen. Like sometimes there's not that, because these things can happen pre-language development,
Yeah.
or someone might be protecting themselves from fully remembering an experience because it was so difficult. And so it could be that like there might be an impulse in the body, like the feet, there's energy in the feet and the legs, and like what do they want to do? They want to move.
Yeah.
You know what I mean? So it could simply be imagining oneself moving, or it could literally be, is it okay to allow your feet to move?
Mhm.
And I was working with a client once, and she said all of a sudden she had this memory of being between her parents, and there was interpersonal violence happening in the home, and that she had this, like, this just came up. We didn't prompt this in any way. It was just noticing sensation, and then she had this impulse to, like, push, like, be in the middle, but use her arms to push them apart,
Mhm.
right? And so we just said, "Is it okay to notice that impulse? What would it be like to allow yourself
Mm.
to follow the impulse?" And then she literally, like, had her arms moving out, and she made a big space, like, as big as her arms would go, and she said, "I'm pushing them apart, and I'm safe here." And so then she noticed some kind of release in her body and felt a sense of groundedness,
Yeah.
in that experience, and then expressed, like, I'm feeling a sense of safety in this moment, right? And so both of those approaches are like kind of present center the experience, right? But it could be pulling from past experience, either where there's a vivid memory or there's not, there's just something happening, but I have this impulse to do this movement. It could be a
Yeah.
movement, it could be a thought.
But that physical act in that therapeutic context helps create a greater sense of psychological comfort or safety.
Yeah, so it's a way of allowing the completion. Like for this particular person,
Yeah.
the thing that they couldn't do was to have physical safety in that moment or to
Yeah.
literally separate their parents in that experience. They were too little. They were a kid,
Right.
like, and so, but in that moment, they were able to, like, through their movement and their imagination of separating that from happening, they were able to have that, like, protective response and allow that within themselves.
As a clinician working um, within this space, and you touched on this a little bit earlier about the importance of the psychologist or the therapist being in the right space themselves, the level of preparedness, the connectedness to
Mm,
their soma, right? Their body, their mind, their
yes.
experiences. What kind of somatic work do you think is required for clinicians to be well regulated themselves and prepared to do this kind of work?
Yeah, I'm a big fan of every therapist doing their own work, like us
Yeah.
being in our own therapy, getting our own supervision, consultation, doing our own depth work. And something I really, really valued and appreciated about my training in somatic experiencing and in NARM is that they are a very time and it's a time and financial investment to be in these programs. And in both of them, there was a personal requirement of engaging in kind of experientials, right? So the SE was a 3-year program. So there was a requirement. I can't remember the exact numbers, but I needed to do 8 to 10 personal experiences of the modality so that
Yeah.
I'm learning it from the inside out. And in the training program, in live time during the modules, you were experiencing what you were learning,
Yeah.
right? So that's really important. And in NARM, there's also this experiential component where you needed to engage in your experiential consults so that you were learning the model. And anytime I teach something, I always say, don't go experimenting on your clients, experiment on yourself,
Yeah.
right? Like you've maybe gone to an hour presentation on this. This does not mean that you are qualified to do this modality, right? It's really important to be in our scope of competence and to be doing the work. And so I think that every therapist should be doing their own work in whatever modality that they're practicing
Yeah.
to know what it's like to be a client in that modality. And that to me is very responsible, but then it just deepens your own learning because you're learning it from the inside out, you know?
Yeah. I I think that is so important, and unfortunately something that I feel like we've largely lost in the training of clinicians these days. And it's that it gets tricky when you use the word requirement, right? But I think it's so important that psychologists, through the process of their development, and honestly, throughout the course of their life, be engaged in their own therapeutic process.
Yes.
So so that you understand yourself in context much better. But also there's that the flip side of it is that it helps build real empathy for what it's like to sit in the other chair, what it's like to
Absolutely.
sit across the room. And I think unfortunately we've lost too much of that in the training of future psychologists.
I agree. It seems like the training is a lot about techniques versus like who we are. And for me, I enjoy depth oriented work, so NARM is a depth oriented model. So there's a lot of utilization of self and our own countertransference. And so we need to understand like our impulses to sometimes we have an impulse to rescue, to save, to, like this imposter syndrome that that some of our, students have that even seasoned therapists have at times. It's like, where's that coming from?
Mm.
Like, why am I doing the intention that I'm doing or the intervention, excuse me? Why am I doing this intervention? How is it in alignment with my theoretical orientation and my understanding of the client and what they're wanting for themselves? I think that's really key to understanding things. Why am I talking right now? Sometimes therapists, they become very verbose. They want to explain and prove they know what they're doing, but where is that impulse coming from? And is that
Yeah.
helpful? Is that meeting the client where they're at? So I think that's where like the depth work that we do can help inform our practice. And I get really excited about those things.
Yeah, it's that I think it was Frankel said something akin to between the stimulus and the response is the power to choose. And
Exactly.
and it kind of sounds like what you're describing is expanding that gap between the
Yes.
stimulus and response for really meaningful and deep introspection to understand what the best response will be.
Yes, I love that quote, and that quote is in the trainings that I go to. We use that quote, and it's so beautiful, and
Yeah.
yeah, that's super important.
Well, Dr. Hardin, I wish we had another hour or two because I feel like we're just getting warmed up.
I know.
But I've really enjoyed our conversation today, and thank you so much for joining us.
Yeah, thank you so much for having me. I really enjoyed our conversation today and would love to come back for a part 2 if there's ever an opportunity.
Oh, I would love that as well.
Yeah, great.